So shall I start?
Yeah. Go ahead.
Good morning to one and all. My paper today is Stitch in Time Saves 9 Lens-Induced Glaucoma in COVID era. I have no financial interest. Coming to the introduction, lens-induced glaucoma is a secondary form of glaucoma in which the crystalline lens is involved in the mechanism of intraocular pressure rise, and often it is a marker of delayed cataract surgery. In India, cataract is the major cause of blindness in elderly population, and population expansion has only worsened our cataract backlog. 2020, early 2020 enters COVID, and with it enters COVID restrictions and cessation of elective surgery during the pandemic, which not only made, which further made eye care inaccessible to the general population. Aim of my study is to determine the clinical profile of lens-induced glaucoma, reasons of delayed presentation, and outcome of management of glaucoma in COVID era. The study place was Department of Ophthalmology, Vimsar, Bulla. It was a hospital-based prospective observation study. It was done in May 2020 to August 2021, and patients presenting to the ophthalmology OPD with LIG were included in the study with a sample size of 39. However, history of trauma, LIG due to subluxation and dislocation of lens, patients with history of cataract surgery or laser capsulotomy, known cases of glaucoma and vitreoretinal disorders, and other causes of complicated cataract were excluded. Travel and contact history was assessed in each case, and COVID-19 rapid antigen test was advised on suspicion. Informed consent was taken from each patient, and detailed history was taken. These were the study tools: and visual acuity, intersegment examination, gonioscopy, intraocular pressure, fundus examination, socio-economic status, demographic data, and reasons of delayed presentations were assessed. COVID-19 RT-PCR for each patient was advised before admission. Each patient underwent SICS, manual SICS, and 37 of whom received posterior chamber IOL, and 2 patients received scleral fixated IOL who had inadequate capsular support. Patients were followed up on day 1, 7, and 30, and best corrected visual acuity on last day of follow-up was graded as good, useful, and poor. My study had a female preponderance, and majority of patients hailed from rural background with a mean age of 64.1 and a standard deviation of 9.34 years. 16 patients were illiterate, and only 11 received secondary education and above. Socioeconomic status, according to BG Prasad scale, 21 were from lower middle class and 10 were from middle class. The common clinical symptoms were pain, photophobia, headache, and watering, and the most common clinical sign encountered were ciliary congestion, mid-dilated pupil, corneal edema, and 2 had even developed iris atrophy. The most common diagnosis was phacomorphic glaucoma. Visual acuity at presentation, 15 patients had hand movement positive, and the best visual acuity assessed was 1/60. Mean IOP at presentation was 46.28. The mean IOP, however, was assessed pre and post-op on day 1, 7, and 30, and the decrease in IOP was found to be statistically significant. Visual acuity at the last day of presentation was assessed according to the visual grade, and it was compared with the duration of symptoms found, and it was found to be statistically significant. As we have seen the plight of migrant workers, distance traveled by patients was also assessed and compared with the duration of symptoms, and it was found to be statistically significant. Patients who traveled more than 100 kilometers were usually late at presentation. Reasons of delayed presentation: patients were divided into COVID-related reasons and non-COVID-related reasons. COVID was a major determinant of late presentation, being COVID-19 lockdown and fear of COVID infection. Amongst non-COVID reasons, the most common causes were better vision in the fellow eye, financial problems, and no one to accompany them to hospital. Coming to the discussion, similar studies have been done by Setola et al. And Srishta et al. In Nepal, and a study by Ayob et al. In southern part of India. We found COVID-19 to be the major determinant in the late presentations, followed by better vision in the fellow eye, which was also seen by Ayob et al. Monetary problems were also a finding in our study, which was also found by Srishta et al., Sitola et al., Pradhan et al. However, our study had a smaller sample size, which is our limitation. Other studies had larger sample size, like 165 by Iobital, and Pradhan et al. Had 413. Coming to the conclusion, lens-induced glaucoma often precipitates in elderly population with long-standing and untreated cataract, and it can be prevented by early intervention with cataract. COVID-19 lockdown, fear of getting infected, good vision in the fellow eye, and lack of finances were the major determinant of late presentations in our study. Most patients were pseudophakic in the fellow eye, and there was a lack of awareness among patients about early treatment of cataract. And patients and general public should be educated about the risk of lens-induced glaucoma and its dreaded effect on vision. Early presentation with less duration of symptoms had better visual outcomes and as compared to who reported late. And indeed, a stitch in time in case of lens-induced glaucoma saves 9. These are my references. Thank you.
Thank you. It's nice presentation. Why female preponderance in LIC?
Sir,
This is a session of community and social ophthalmology.
yes, sir.
Answer in this background. Why
Yes, sir.
female?
Sir, often female are the neglected gender. Their complaints are often ignored in household. Even if they complain of low vision, it is often ignored. I think that's the reason they land up with lens-induced glaucoma. In our study, they have landed up more.
Have you seen that this incidence of cataract in Indian females are more compared to males? Have you
Sir,
noticed it?
yes, sir. In our normal OPD, in our setup, it is more we find female patients, and a male patient can come himself, but a female patient always needs an accompaniment with her. On asking about delayed presentation in female patients, they often complain that they had no one to accompany them to hospital.
Okay, thank you.